Hello and welcome to It's a Code You, mental health support for those working in healthcare. This is a podcast created for healthcare employees to explore not only issues relating to mental and emotional health, but also unique challenges that those working in healthcare are faced with. Your hosts are Adina Tucker, a licensed clinical social worker with Dartmouth Health, and Jennifer Hinsey, an MSW also with Dartmouth Health. Hello and welcome to It's a Code You. And today we are diving into simple, effective self-care strategies that you can implement even when time is scarce. So if you're feeling burnt out, overwhelmed, or just in need of a moment of peace, or perhaps all you have is a moment or two, then this episode is for you.
The phrase self-care is one that we hear a lot, but I think it often rings hollow because it's repeatedly presented as something that's unattainable or maybe unpractical or rooted in privilege. I mean, heck, how many times have we heard, engage in self-care, go take a 2-hour-long bath? A number of things that are also high cost, I think, a lot of times, right? Just get enveloped under, this is self-care. Okay, but the act of self-care, it's more than just a buzzword. It really does play a critical role in maintaining our mental, emotional, and physical well-being. And this is especially true for folks who are working in high-stress professions like healthcare. The term is also often commercialized, right? There's so many things marketed to us that we can purchase to purchase our relaxation, purchase our care for ourselves. But genuine self care goes beyond spa days and relaxation tools. It's about sustainable habits that prevent burnout, improve resilience, and enhance overall quality of life. And right, self care certainly can include things like taking a long bath, going to a spa, playing some relaxation music. It can definitely include those things too. It's not to say those things aren't valid. But we really want to emphasize that you can prioritize self care even when maybe you don't have the money to go for those big splurges or huge gobs of time to really check out of regular life. So let's get into it.
I like that you mentioned that often self-care is like the pricey kind of stuff. I saw this thing once and this lady was talking about like a reset and she was like, I took a 3-month sabbatical and went to this wellness retreat and my life, I'm so much more centered. And not to make fun of that, I don't mean to do that, but that's not attainable for most people. A lot of people can't go 3 months without a
Yeah.
paycheck. So I think finding ways to build it into your routine is probably the best thing for most of us. So here are some of the self-care real world benefits that are beyond like the trendy things that we hear. So first, it prevents burnout and compassion fatigue. Studies show that consistent self-care practices can reduce stress and emotional exhaustion, and that improves job satisfaction and patient outcomes. It supports mental and physical health. So, self care activities like mindfulness, proper nutrition, and getting adequate sleep contribute to lower anxiety, reduce risk of chronic illnesses, and then just better overall function. It enhances productivity and focus. So, when healthcare workers take small but intentional self care actions, they experience improved cognitive function, decision making, and emotional regulation. And I think actually this is one of the things that we've talked about in the previous podcast is that a study that they did with military that showed how burnout and stress can affect your working memory and how doing things like self-care things like mindfulness throughout the day can actually increase those things that get damaged by stress. Regular self-care encourages long-term resilience. So it's not about just feeling good in the moment, it's about creating a foundation for sustained well-being and career longevity. It also redefines your boundaries and priorities. So true self-care includes things like saying no to overwork, setting boundaries, and prioritizing your mental health as a non-negotiable part of work life. And that's, I know, hard for a lot of us to do, but it really is essential to staying grounded. When it's approached holistically, self care becomes an essential professional duty, not a luxury that is only available to some. And it's a way to sustain energy, passion, and effectiveness in both your work and personal life.
It is. Yes. And when we are talking about why self care matters for folks who work in healthcare in particular, well, we know that healthcare professionals face some pretty intense physical and emotional demands. And that can be on a daily basis, even. And in fact, studies show that burnout rates among doctors and nurses are at an all time high. The Mayo Clinic did a study in 2019 in which they found over 50% were reporting symptoms of emotional exhaustion. Now, when these symptoms are left unaddressed, burnout can lead to things like decreased job performance, compassion fatigue, and even mental health struggles. And if you're listening out there and you work in healthcare, maybe you yourself are experiencing some of these things. So we want you to know that prioritizing self care isn't selfish. It's absolutely essential for both your well being and the quality of care that you provide to your patients. There was a 2022 study by the World Health Organization that highlights that consistent self care practices can reduce stress related illnesses and improve job satisfaction for healthcare folks. And healthcare workers who engage in regular self care report things like increased resilience and a stronger sense of professional fulfillment. Recognizing self care as a professional responsibility can really help us shift our mindset towards sustainable career longevity. Now, you might be asking yourself, but how do I realistically fit self care into my busy, overworked schedule? Well, one expert in self care, author and psychotherapist, Ashley Davis Bush, who is a licensed independent clinical social worker, recommends what's called microtizing self care. So let's talk about what this means. Well, it means to engage in small habits in our daily lives that have a big impact on our overall well being. She says the validity of micro self care has been found in recent neuroplasticity research. Small repetitive practices matter, both in creating new neural networks in our brains and creating sustainable self care. And she writes, it can be as simple as shrinking down the macro self care activities and practices that you already love into their most powerful essences. These small, repetitive self care practices really do matter, and they can make a difference. Again, in creating these new neural networks in our brains, in creating what can be our newfound sustainable self care.
So let's look at quick and practical self care strategies. And here are just a few techniques you can use to create your own personal toolbox of micro habits. Self care activities that you can do in a few minutes or less, which can be then woven throughout your workday. So the first one is the 60-second reset. And involves using deep breathing techniques such as the 4-7-8 method. So you inhale for 4 seconds, hold it for 7 seconds, and then exhale for 8 seconds. And that can lower stress levels in just a minute. You could also set a phone alarm for periodic breathing exercises during a shift. That can be a really practical reminder. Or you could take 1 to 2 minutes to focus on your breath while standing in a hallway, sitting at a nurse's station, or even washing your hands. A few deep, intentional breaths can really make a difference. And it's really one of those good mindful techniques where you're really just focusing on like your breathing and even the sensation of the water as you're breathing to just take you out of, okay, what's on my to do list? What do I have to do next? And just ground you for a second. And I guess that goes into the next one, which is mindful moments. So, taking a few seconds between patients or tasks to ground yourself. So, whether it's noticing your breath, like we were just talking about, stretching, or simply being aware of your surroundings, mindfulness reduces stress. Consider using a mindfulness app for guided micro practices. Engaging your senses throughout the day is also a great way to promote mindfulness. sip a warm drink mindfully, focus on the taste and the temperature, feel the weight of a pen in your hand. These small acts of awareness can bring moments of mindfulness into a hectic environment. And then the next one is hydration and nutrition hacks. So, small choices like keeping a water bottle nearby or packing protein rich snacks that can boost your energy and prevent fatigue. Dehydration is a common cause of headaches and sluggishness. And I know from working on the floor that it can be very difficult to stay hydrated when you're running or you have a lot of busy days and you're going from patient to patient. So, is dehydration is a really important one to avoid. And you can infuse your water with citrus or cucumber, electrolyte packets, a shot of honey, whatever you prefer that will make it more enjoyable, especially if you tend to want things like soda or and don't really enjoy water. You could also use your phone or hydration app to remind you to drink water at regular intervals. That might be good, especially if you're working on a medical floor and it's hard for you to remember to take breaks because you get so on autopilot. So having a reminder to go drink some water. Some apps will even track your water intake, and some water bottles include water intake goals printed on the outside of the bottle. And that helps you track how much you're consuming throughout the day. I used one of those when I was pregnant and working in the medical field. So it's nice to see you can see the marks on the outside of the giant jug of water that you're drinking it. And then when you do get a moment to eat, focus on your meal. Avoid eating while multitasking or doing notes or rushing through it. That can also lead to poor digestion and just less satisfaction with your meal.
Yeah, I also love the water bottle with the tracking and goals, the little because it's neat. It's like your water bottle has its own smart goals on it. Maybe they're not entirely smart goals, but it's just nice to have a little something that as you're drinking your water, you could feel like, oh, you're reaching this little micro achievement at some point during the day. Like, yes, I've consumed enough. I might be ahead of my clock on my bottle at goal. So that's just a fun little boost you can give yourself. That's also healthy water. Now let's talk about some stretching and body movement, both of which research suggests that can improve our confidence on the job and reduce stress. You could do a quick stretch, like rolling your shoulders or standing up straight, adjusting your posture, standing tall. Both of those things can make a great difference. Adding a 2-minute movement break between long shifts can definitely help you prevent some physical strain. And also maybe ward off some of those usual physical aches and pains that are associated with long hours at a desk or standing for long periods of time. And maybe you love to take long walks in the woods in your off time, but when you're at work, you don't really have time for that in the moment. So you could do a march in place exercise and add in 10 jumping jacks to just get your blood flowing. Or maybe you're not able to get to a yoga class today, but you can benefit from making it a point to just stretch your arms and breathe deeply on your way to lunch, on the way to the restroom, or as you just move through the hospital throughout your workday. Now, let's also talk about micro meditation. So, even 2 to 5 minutes of guided meditation, maybe using apps like the Calm app or Headspace, Insight Timer, even, they can help reset your mind and lower your stress levels. Some hospitals now provide quiet rooms specifically for meditation, so check out if your workplace maybe has one of those. Some hospitals also have chapels that can provide a quiet place for reflection during the workday. You could also visit. And alternatively, you might try while on break just closing your eyes for a moment and focusing on the sounds around you without judgment. Instead of trying to escape the noise, simply observe it as part of that present moment that you're in. It can also be helpful to have a little social recharge while you're at work. A brief positive interaction with a colleague, whether it's a shared laugh, a few words of encouragement, that can be something that really improves morale and gives you a nice positive boost to carry throughout your day and for your coworkers too. Creating a small workplace gratitude practice, even like writing a little thank you note to a coworker, that can foster a really nice supportive environment. And now, you might not immediately think of sleep or sleep hygiene and restorative naps while you're on the clock, but we all know that working long shifts can definitely make sleep challenging, especially if maybe you fluctuate between a day shift and a night shift every week. So, prioritizing quality rest whenever possible is crucial. When you're at home, the CDC actually recommends creating a pre sleep routine, such as limiting screen time before bed and using blackout curtains, for example, to improve your sleep quality. And pulmonologist and sleep apnea specialist Dr. Samuel Gurevich, recommends short naps, or folks might know these as power naps, when feasible, because they can also restore alertness and cognitive function. Now, power napping in a hospital setting can be tricky, but with some creativity, you can actually make the most of even a short little break. So consider if your hospital has some designated rest areas, take advantage of those on one of your breaks. If unused patient rooms or meeting spaces are available, maybe you could ask a trusted coworker to wake you up after a set time. You could also set a timer for yourself. Aim for 10 to 20 minutes to avoid grogginess. You could use a jacket or a backpack as a pillow. If you're napping in a chair, try to make sure you're supporting your head to make it a little bit more of a restful nap. You could also try something called the coughing nap. This is where you drink a small amount of coffee right before your nap, and then the caffeine will kick in just as you wake up. And that can actually make you feel a bit more refreshed once you actually do wake up from your power nap. You could use noise canceling headphones or earplugs that can help drown out the background noise, and even maybe play some white noise or calming sounds during your power nap. And dimming the lights. You could use an eye mask, you could cover your eyes with a cloth to just try to help signal your brain it's time to rest during this little power nap I've taken on my break.
So, some resources and next steps, if you're looking for some additional support, here are some resources. You could use apps for mindfulness and stress management like Calm, Headspace, Insight Timer, 10% Happier, um, wellness programs. So, you could check to see if your hospital or workplace offers employee wellness programs or mental health resources. We work at Dartmouth and we have things like, I know they have weekly meditations, I think, and yoga. And then there's EAP services as well that have some different things available. And other hospitals I've worked at have also had similar things. So I definitely check into what your specific workplace offers. Hotlines for support. So if you're struggling, reach out to the National Suicide Prevention Lifeline at 988 or the physician support line at 1-888-409-0141. You could look at some books on self-care, The Resilient Practitioner by Thomas Skovholt, and Self-Compassion by Dr. Kristin Neff. And then there's some online communities that you could join. So joining online support groups for healthcare workers, such as the Happy MD or Clinician Well-being Collaborative, that can online support groups or any support groups really provide a sense of belonging and shared strategies for coping. I am sitting at a desk all day. So there's a couple of on
Mm.
TikTok Pilates people that do like at your desk stretches and 2-minute stretches and things like that. So you could look for different types of things like that, and even meditations, I'm sure, just little mindful practices. So check for those kinds of things. So in closing, self-care doesn't have to be time consuming. Even small intentional actions can have a powerful impact on your well-being. And if you found this episode helpful, share it with a colleague who might need it. Remember, taking care of yourself isn't a luxury, it's a necessity. And taking just a few minutes each day to check in with yourself, to sustain the energy and passion that brought you to this profession in the first place. I'll also note that we will put all of the resources in the show notes. So if you missed a phone number or the name of something, they'll be in the show notes for you, for anyone who's interested. And if you have any questions or comments or feedback, you can email us at dhbhs.media at hitchcock.org. And we so appreciate you listening.